Hello, good morning, dear Christine and David. Because yesterday, Christine asked me some question about HIFU, and she asked me which probe should be on which area. So I made this video. I think video will be more vivid to answer this question. Okay, and I will make a whole the operation about the HIFU. Now I just want to show you this probe. This is the 4.5 probe. You can see the two line. This 25 millimeters. This is the effective line. So you don't see this area is so big. It is not the effective. Okay, only the 25 millimeters is the effective line. Okay, so then I will show you the operation. Here also have a point I should tell you. First, here has 3 probe, right? But you should use the 4.5 probe first, then the 3 probe, then the 1.5. Okay, this one use first. Open the machine. Okay, now you can see this is the patient name, patient ID, and the clinician. Patient name such as Sky. Okay, Sky. Oh no, backspace. Sky. Enter. Patient ID such as is 123. Okay, and enter. Clinician 3, 4, 5. This is okay. Enter. Okay, now we can start treatment. Maybe this will take a few minutes. Update the patient info. So wait. And I have invited a model to show this operation. Okay, let's take a few minutes. Okay, yesterday you asked me which probe should be used on which area. So please don't worry this question, because now I use the 4.5 probe, yes, and this is one have shown which areas you should be treat. You can see this one and the neck. This area should be treated, and have the number. The number 31 means you should have done 31 shots. You can touch one. You can see touch. This have shown 31. You should have done. If I have done 1 shot, this 0 will become 1. If I have done 2 shots, this 0 will become 2. If I have finished all 31, this will have been 31, and this means this area treatment is be finished, and then we can move on this area. Okay, understand? And this area shown, and the 2400 means the total shots of this probe. Your machine is not 2400. Your machine is 5,000. Okay, because this is old type. Your machine is 5,000. And this is energy. You can see the maximum and the minimum. Okay, and this is the length. It's 25 millimeters. It means this one you don't need to adjust, because this is the largest length, can means the patient or your client can have the most effective line. Okay, and you can just, we usually use the low release analyzer for the test. Okay, this is if you use the 4.5 probe, this one will be light. If you use 3, this one will be right. If you use this will be right. Okay. So the machine operation is very easy. And now, and next, I will show you how to draw the line to the face. Okay. Okay. Now we start the treatment. Before the treatment, we should ask the patient some contradictions, such as if she has washed all of the makeup, and if she's woman, and if she's pregnant, if she is the menstrual period, and some those contradictions. Okay. Now I will ask my patient, he is all okay, so I will start the treatment. I will draw the line. I will draw the line on the face. I will use the left face as the example. Okay. Now, all we can see, you can touch this area. This will have bone. Okay. You can draw the line like this. This middle. Okay. Draw this line to this area. Okay. And this is the first line and the second line. 对，这里对吧？ Nose. 这个玩意儿，我就是让那个工厂给你发这个，因为这个丢了嘛。不是，是这断了。对，这儿也是，这个肯定得发，但是它这个也丢。To the middle of ear, and the second line, and we will know this one also will have bone. Just something like this. 你用美图秀。在美图它是脏的，我没有看到。给修成白的。然后由于咱们得拆这器皿。 没事，就这样画。Okay, this is a 3 line, and now this will be the eyeball here, join line. Okay, now this you can see this one and the middle. And you draw the line such like one finger. Okay. Now you know, because the treatment line is the 25 millimeters, so almost 2 fingers. You can see almost 2 fingers. So I use 2 fingers. Okay. You can see that. Okay. Yeah, so you can see now I have drawn up this area. Have divided 3 treatment parts. This one you shouldn't be treated because this one is a little dangerous. So this one, the 3 treatment parts you should be treated. Okay, such like this. Okay, you can such as like this. Yeah, such like this. So I will not do the all treatment. So I just use this one, for example. Okay. Now you can see this. Now I just touch this area. Have shown this 31 shot you should have done. Yeah. Okay. Okay, this is 4.5. And the cold gel. And before the treatment, we should use the cold gel. This can be reduce the painless of the patient. Okay. 有那个棉签吗？看看棉签有没有。Thank you. Okay. Okay, now we can start treatment. Because you can see that we touch this area, so now we can do this treatment area. Okay, it's like this. Okay. Okay. So all the treatment, first we should ask the patient's feelings. If she will feel a little warm and a little hot, and he will feel that the probe is into his skin, this is the right energy. So the first shot, I will ask the patient's feeling. Okay. Now we start. Okay.
一个小时。
How's the feeling? 怎么样感觉? The patient said that he feel warm and a little hurt. So maybe this is the right energy for her. So we should start the treatment. And you have seen that I have done one shot, right? This total, the patient total now have this is 1, not 0. If I have done 2, yes. And they also have one point I should notice you, because the machine is for the facelift. So when you do the treatment, you should put a face or use the probe, this or this, so that can strengthen the effect. Okay, we can do the 2. Okay, now you can see now this is 2. And if you want to finish the order 31, so you just slowly move. You can see this is 1, 2, 3, 4, 5, 6, 7, and until there, so finished the 31. I wish you can understand. I mean, this is 1 shot, 2, 3, 4, 5, 6, 7, and all this treatment area, you should have done 31. Okay. If we have finished this, such as this, so we can start at area until there. You also should be done 35, and this is 15. And in this area, you should have done 15. Such as like this, I have done 1. Okay. So you should put more on gel. The gel can reduce the pain. Okay. Okay. You can see now this area is shown the 15. Okay. I can do 1 for you. Yeah, this means I have done 1 shot, and you can see this 1, and this up there means 15 have been finished. Okay, so this area is just example. If you wanna do this is all is same. Okay, now this is the 4.5 probe. Now I will show you the 3 probe. Okay. Of the 4.56, 4.5, and now we change the 3 probe. Okay. 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 Now you can see the operation screen, and we open the treatment area of this probe. So you don't worry. So it means this area should be treated by this probe. Okay, you can touch one to show. Okay. Before we have done this area, this area should be used 31, right? Now should be used 28. Okay, you can. So we use the same area for the experiment. Okay. Now it is the 31. Such as, okay. Ready. This is this area, 28. This area, okay. Okay, I'm ready. Yeah.
整个手
Don't forget lighten up the
手掌
screen.
整个手掌提来。
Don't forget light up the screen. Okay, such like that. Such like that. So this we can strengthen the effect. Okay. Okay, ready. How about the feeling? 没什么感觉是吧？The patient said no feelings. No feelings means the energy is not right. You can see the net energy is the minimum, so we can add up. Okay. We can add up to this. Ask her the patient is okay. Okay, I cannot the energy. Don't forget lighten up their face. Okay.
最近我不明白呢，
How about the feelings? 怎么样？
有点打到牙了。
Okay. She said now the feeling is more stronger than before, but she still will feel a little pain. When the patient feel pain, we have one suggestion for you, such as like that. Such like the, I don't know how to describe this, but it's like this. This can reduce pain, reduce the pain. Okay. Yes, such as that, like that. Okay, I had done this surgery. How about that? Yeah. She said she have done this will be reduce the pain. Like that. If the patient think a little pain, you can suggest the patient do that. Okay. So now you can see that we have done 3 shots. We have 3, and also like the 4.5 have this 1, 2, 3, 4, 5, 6, up there have finished 28. Yeah. All is the same. This area. And because you don't have the much experience about the hive, so here have some area you should avoid to this, because you know this is eye. This area you can down, and this one is a sensitive part of the blood, so you also you also should avoid this part. Okay, yeah, this line, this we should avoid, and this part we also should avoid. Okay. 好吧，差不多。Okay. Now we okay. Now this is the last one, probe 1.5. Okay. And you can also show the screen. This also have the treatment recommended treatment area. Okay. It means this area should be done by the 1.5 probe. Okay. Now.
告诉他必须弄冷胶。
Yeah, the cold gel. You must put the cold gel on the treatment area. Must. Okay. Here have some treatment area you shouldn't have it done. Okay, such as like that. This one, you don't need to do. This area, you don't need to do. Okay, and also the eye, okay, and this one, because this one is a sensitive part, have a lot of blood, so this one also we should be done. Okay, 它这里不是有很多眼角纹什么的吗？ This one, but this because we we have the wrinkle of the eye, surrounding the eye. This one can be done.
画一下。
Yeah, this one can be done. 画在这吧。
这样画圆圈就行。
那你来画，没事，你来画。Yeah. Yeah, because there will a lot of wrinkles, so we can do some treatment over there, such as like this. Got it. Such as like this area. This area is for the along the line wrinkles. This area, okay. Now we can help do the treatment. I have done some example about this. 我等下在这儿也涂点吧，给他在这里涂点。
多弄了比较。多弄了。
Okay. Put some gel. You can see this means have 15 shots. You should have done around this area. So, okay. Okay. It's line. Don't forget, up the face.
没有呀，有的售后不挣钱。你都是老板呀，你们部门领导去研究。对啊。偶尔我发现这个事情好像一次延长一次，延长3个月，但是只是换了一个，不是说
再往眼里。
还有点过去点。
无所谓，这无所谓，反正就是部门说的。现在我们海外没有怎么。应该去销售你那个销售按消费费用该怎么弄怎么弄。
Okay. So now you can see how 2 shots held down. 2 shots held down, okay? And all the treatment area, don't be forget. Light up the screen. Lighten up the screen. Lighten up the screen. Okay? This can strengthen the effect. 我刚刚想讲什么来着？我刚刚有个讲，我忘了。Okay, now I almost have finished all the 3 probe treatment, but here have some point I should notice. I should tell you, all the treatment, all the shots should be done by this. Is this line? Should by this, not this. Okay, all should be by this. And use your whole and such like this. Okay, you up the skin. It's like this. Okay, it's not this. All is done by okay, and after you have done the whole face treatment, maybe you can see some client can see the instant obvious results, but almost customer can see the 20% or 30% results. The amazing effect can be seen after 3 months. After 3 months, you can see the obvious and amazing effect. Okay, after treatment, you only can see the 20 to 30 results. Okay, so if you some your patient and the customer asked you why after treatment I don't see the obvious results, because just you can see the 20 or 30 results. Okay. The last part I will show you how to draw the line on the neck. Okay. We also know this is the throat. Okay, this is throat. We can draw a line up there. Throat here, and like here. This is also is the half face. We should avoid the throat, so we have the finger, one finger. Okay, such as like a 2 finger. Yes. Yeah, 发现了。2 finger and 2 finger. Yeah, it's such like that. And this also 2 finger. Divide 3 treatment part. And at the throat, we draw this line. So, this is the treatment area you should be have done. This, okay? This avoid. And have 1 finger, 2 finger, 2 finger, two finger. Okay. The right side also is the same.
所以
Avoid.
就是理论上机器是可以
Two finger,
打好
two finger, two
但是
finger.
打那个机器太窄了。
Okay.